Another individual on the team who she may or may not actually get to meet is a diagnostic radiologist. This is someone who's going to be reading the scans that are done periodically, whether that be a CAT scan, a PET scan, could be even an MRI. But that is an individual who is diagnostically trained to know how to read those particular imaging studies and then provide a report to the treating physician, such as the medical oncologist, so they can determine, has the cancer spread further? Has it gone on to other organs? Is it now shrinking? Demonstrating that the systemic treatments the medical oncologists are providing are in fact working, which is always exciting news. They also give biologic targeted therapies. These are for HER2 positive breast cancer cells that have spread onto other organ sites. Additionally, CDK4/6 inhibitors combined with hormonal therapy is another treatment that medical oncologists do. And this is for patients whose advanced disease is estrogen and/or progesterone receptor positive and HER2 negative. For those that their tumor cells are HER2 positive, they also might be receiving a biologic targeted therapy drug classification. And then the newest one, which is where we've really made great progress and it's quite exciting to see it, is immunotherapy, having her body treat her own body using the immune system and giving drugs that do foster her body to be able to fight these cancer cells themselves. Another individual on the team that she usually will not meet is a breast pathologist, someone who's looking under the microscope at prepared slides that have been obtained usually from a biopsy of another organ site, confirming that the cancer has spread onto those other organs I mentioned earlier. It's really important that, that a pathologist be a breast pathologist. When you think about it, the pathologist, right from the very beginning, when the individual was first diagnosed with an earlier stage breast cancer, they hold all the cards. Their accuracy determines your treatment plan. So how big the tumor is, what kind of breast cancer it is, what grade it is, what stage it is, and even those biomarkers of estrogen, progesterone, and HER2 receptors are determined by that pathologist. They also determine the Ki-67, which is a marker to tell us how aggressively this cancer is growing. So you can see that even though the patient may never get to meet that pathologist, is an awfully important person on their team.